Grip with your fingers on the front and the back of the thigh, then apply some pressure through the base of your thumbs, bottom of your palm, thenar eminence there, and then spread the tissue out away from the ITB. Go all the way back up and repeat that just below the greater trochanter. Now I wouldn't start with that technique, I'd usually start with something a bit more flowy, such as a friction down the back of the leg there. So I'm just running behind the ITB over the side of the bicep femoris, using the base of my palm, thenar and hypothenar eminence there. That creates a nice soft pad and contact point to move down over the leg. Then I'll stabilize with the other hand and do the same out over the side of the vastus lateralis, just on the front of the iliotibial band. Although you can massage directly over the iliotibial band, it can often be a bit unnecessarily uncomfortable for the patient as you're grinding down over the band, causing discomfort and not really achieving anything. So it's a recommendation that you go over the front, over that vastus lateralis, but the muscle's going to be much more receptive to massage than grinding down over the iliotibial band. And we can go around the back, down the bicep femoris as well. But you'll also see people using their forearms. That's a nice way of applying a broader sweep down over the posterior lateral side of the leg, and again over the front of the leg. You want to keep it fairly easy for yourself so you don't get any unnecessary fatigue. Certainly wouldn't recommend using your thumbs, because over this large area your thumbs are going to become fatigued pretty quickly. The band attaches to the glutes, particularly the superior fibers of the glute max have a big influence on the tension through the band. So I'm going to turn the patient round now so you can see, but ultimately we want to get into the glutes in order to reduce some of that tension through the lateral leg. Again, you don't want to strain your fingers by trying to get in there with your fingers or with your thumbs. So if you can, use your elbow to apply the pressure into the glute region. Be careful, because you can often find some tender spots which can make the patient tense up and jerk a little bit. So for your client, just gently move around, mobilize the soft tissue, and ask for some feedback on any tender points they may be experiencing. Another area to have a look at is off the lateral hip here. That's the greater trochanter. You can feel that clearly underneath your hand on the lateral hip. Come above that, and between there and the side of the pelvis, that's the iliac crest. Here you'll find some of the muscle fibers of the gluteus medius and gluteus minimus. So if you get your elbow in there, that again is another place which is often very receptive to soft tissue work. Massage will only go so far. The actual cause of the problem will probably be remedied by some strengthening activities. So that's the video for you just here. See you in the next video.